Good afternoon, Dr. Henry. Report out of Ontario that they already are using rapid testing, the ID Now one and the PanBio rapid antigen tests. They're using them in 10 hospitals and 30 long-term care facilities. Is that a sign that perhaps they got more of the supplies than we did here in British Columbia, or that they may have figured out how to deal with some of the concerns that have been identified here?
Well, it's a bit of both. They have been distributed by population, so we get fewer than Ontario because they have a much larger population. And all of us are looking at the validation in the places we want to use them. But our plan is to use them in very similar ways to what Ontario is doing in terms of detecting and helping rapidly identify cases in remote communities and in long-term care, and in some cases in hospital outbreaks. So it is for symptomatic people, so they're not doing testing of asymptomatic healthcare workers using those tests on an ongoing basis. It's to help manage outbreaks. But I'm still hopeful that, particularly if we get some tests that are more sensitive and work better in people who are pre-symptomatic, so it's that period of time before showing symptoms where people can spread the virus, or asymptomatic, and we can get a nasal swab instead of a nasal pharyngeal swab, then it's amenable to self-selection, self-testing, that we'll be able to use them. One of the challenges that we've had across the country, and I talked with my colleagues in Ontario about this, and our lab has been talking with their lab too, is trying to understand how to best use them and to validate them again against what we have and the NAT tests we're using. So they've just started that, and we're looking at it too. I was hopeful that we would start right before now, but it takes time. One of the biggest disappointments in this pandemic, and I'm just thinking back to Justine Hunter's comment about, what could we have done more, is that we have had real challenges and globally in getting accurate tests. Our NAT tests, the ones that we have that we're doing in the lab, are excellent and they work really well. But the rapid tests and the serology tests have not been as useful as we had hoped way back when. I remember saying, once we get the serology tests, we'll be able to find out. But the serology tests took an awful lot longer. They're still not as accurate as we need, and you have to do 2 tests. And there's been hundreds of rapid tests developed, but most of them aren't valid enough to help us on a day-to-day basis yet.
Do you have a follow-up, Vaughn?
Yes, please. I wanted to ask about the review that will be overseen by Dr. Brown. A while back, you referred us to the guidelines or the recommendations of the National Committee on Immunization, what it suggested should be the priorities, given that there will be a shortage of vaccines initially. Is that still the general framework we should be looking at to see how it will be done here in British Columbia? And are there different things about BC that would perhaps mean different guidelines or changing some of the guidelines?
Yeah, so Dr. Brown's not going to be doing a review. He's going to be working with me to make sure that we have all the operations and logistics in place. So when vaccine comes, we can get it into the arms to protect people as soon as we possibly can and most efficiently as we can. But yes, part of that will be communications, part of that will be looking at our IT systems, looking at how do we physically get vaccine that needs to be frozen to -70 to the places we need it to be, who's going to deliver it. So he and I are going to be overseeing that whole program, and part of that program is indeed the question of, within those priority groups of the National Advisory Committee on Immunization, there's 4 large priority groups. We will not have enough vaccine in the first few weeks to months of the vaccine program to give vaccination to all of those people in those priority groups. So where do we start? how do we sequence vaccine over time? We will have enough vaccine to give to, this is me being optimistic. If the what we are seeing about the Pfizer, the Moderna, and now the AstraZeneca Oxford vaccine, and we have contracts, and we've heard the Prime Minister say, we are expecting those contracts to be honoured. It's always a challenge when we're reliant on offshore manufacturing, and there's always things that can go wrong. With all of those caveats, we want to be ready as soon as vaccine is ready to get it to the right people at the right time safely, and to be able to monitor safety. So what we are doing now is taking the NACI priority groups. We've across the country developed a statement of common principles that the health ministers have signed off on, and the premiers will be discussing, and we are using those to look at who gets vaccine first. And I can tell you across the country we're all very much focused on who is most at risk. And how do we protect them best? So it will not be a surprise that people who work in long-term care and people who provide services on the front lines, whether it's emergency department, ICU, COVID wards, are very high on those priorities. But there are other important people as well in many different spheres. So we're all looking at, is there a strategy where we focus on protecting those people who are most at risk in the areas where we're most seeing to protect other communities until we have more fridge-stable vaccine that we're able to give to everybody. So there's a lot of ethical principles we've all agreed upon, and the guiding principles we've agreed upon, but those are the discussions we are having in detail, started a few weeks ago and are ongoing.
Hi, Dr. Henry. Just another question on the vaccine rollout. On last night's federal provincial health ministers' call, Saskatchewan says they asked for more details after the Prime Minister's comments that Canada won't be the first to get the vaccine once it's approved. But there were very few details about the rollout and distribution. What have you heard from Ottawa about when BC would get vaccines? And are you getting enough information now for Dr. Brown to get the province's plan in place for a vaccine rollout?
Yeah, so we have been working on this for a long time. So at those higher levels, there's always details that they need. I can tell you that the BC CDC, we have an immunization program. Dr. Monica Naus is the lead that has been working with our Canadian Immunization Committee, with NACI. I'm on our Special Advisory Committee meeting where we are talking about those details. Exactly, we know, for example, that the Pfizer vaccine will come in frozen trays of 975 doses, and it has to be reconstituted. So we have a lot of information that we do know. We know they're still in the final decision making about how much vaccine each province is going to get, and some of those discussions. But we expect, and what we're planning for is first week of January, week 1 of 2021, to be ready to deliver the Pfizer and Moderna vaccines. And we will have phases after that. So we have the details we know that we need to start that process and to make sure we have everything in place to be able to do that. And that's our focus right now. Whether each lot is going to be approved, so there's a whole bunch of other pieces that need to happen. We have an independent regulator who gives what we call a notice of compliance, which is essentially a license for the vaccine to be used. And they are now doing a rolling process of reviewing data so that they can give that approval as in a more rapid process. Usually we wait till everything's published and then they look at it at Health Canada and determine whether there's enough data to support safety and efficacy. So how well does it work at protecting people? So those key pieces need to be in place and are in place in Canada as they are in other places. So Health Canada, the BGTD it's called, will be doing those approval processes and following the rigorous safety processes, independent safety processes that we have in Canada before the vaccines will be licensed licensed. So our job is to make sure that we're following that process and that we're ready as soon as vaccine is ready to get it into the people who need that protection here in BC. So we are working very closely across the country. I spent most of Sunday talking about this with my colleagues across the country and in detail. So yes, right now we're getting what we need, but there's many things that most of us don't know, including, exactly how much will come, whether each lot will be able to be approved, because each lot has to be tested for safety. So there's lots of unknowns that we all have.
Do you have a follow-up, Georgie?
I do. Many of the people we've spoken to recently in the Fraser Health region are asking for a complete lockdown of the region to try to get a handle on the outbreak there. What's your response to that? And can we get Minister Dix to answer in French for this question as well as the previous question? Thank you.
Sorry, I should have been shorter in the previous question. I think you can say there's lots of unknowns, and there's lots that we do know. And okay. In terms of, I have been in daily contact with colleagues in Fraser and Vancouver Coastal. We know that there's a lot of movement back and forth. We know that there are situations that are higher risk than others, and we know that we have downside impacts for each of the measures that we take. So our focus has been the same and continues to be the same, which is keeping as many workplaces as can safely stay open, so that people get the services and the goods they need, keeping schools open, because we know how important that is for children and for the negative impacts on children and families when children are not in schools, and making sure that our hospital system is not overwhelmed. So we are looking at every option that we have. We've never had a lockdown in that sense here in British Columbia, and we are looking at the important things that we can do to make a difference in where transmission is happening. And we are going through all of the options over the next 10 days to 2 weeks. So by December 7th, we will know what we need to do from here.